Hi, my name is Andreas and I'm the Director of Audiology at Hearing Solutions. I'm here to talk to you today about speaking about hearing loss to a loved one. Talking about hearing loss to a loved one isn't easy. Part of the problem is that hearing loss develops very gradually, and so your loved one might be experiencing their hearing loss for close to a decade before they finally are deciding to do something about it, or when you finally notice that there might be something going on. The hearing loss might be so familiar to them that they've developed coping strategies that they aren't even aware of, and they may even feel that that's normal for them now. The reason for this is that hearing loss doesn't develop the way most people imagine it. Most people imagine hearing loss developing like a volume of the world getting turned down to a point where finally you'd come in and do something about it when it's hard to hear. But that's not the way it happens for most people. For most people, what happens is they start to lose hearing sensitivity at certain pitches or frequencies more than others. For most people, it's the high pitches. And so they start to lose sounds like F's and TH's and S's. As those sounds start to become reduced, they're still able to hear other sounds very well. Some of the vowel sounds, for instance, are coming through at a normal level. And so their perception of the world is that they're still able to hear things fairly well. When we can hear soft sounds in our world, we draw the conclusion that we must be hearing pretty well. Unfortunately, what's happening as some of those consonant sounds are reduced is the ability to separate one word from another is becoming more and more challenged. We might have a harder time separating certain consonant sounds like sit from fit. When those subtle distinctions are missing, it makes speech sound unclear or a little bit more muffled. And that's how problems are going to start presenting. So if you think somebody in your family might be developing a hearing loss, the first thing to do is look for some of the signs. One of the first signs of a hearing loss is increased need for repetition. If you find that somebody's asking you to repeat more often, it's a good clue that they're maybe not hearing as well as they were before. This can happen when they pause and maybe a moment later catch up and are able to understand what's happening. Other scenarios, you might just find that they've missed it. They've heard that something was said, but the lack of clarity means they weren't able to understand exactly what was being said. These are good examples of where some of the sounds are getting through. A lot of the vowel sounds are most likely coming through, and they're hearing that somebody is talking, but some of the clarity that would be able to help them understand what was being said is what was missing. Now, we're often able to cope in these kinds of situations. So in a good environment, such as a one-on-one conversation and quiet, they might be able to get by. And in those situations, what's happening is they're relying on their knowledge of the language, the subject, or the individual that they're talking to. And they're using this extra information to piece together those missing F's or TH's or S sounds. Unfortunately, the price of doing this in the background is that it's a lot of cognitive effort. Their brain is having to work harder to fill in the missing pieces, and that's difficult to sustain for a long period of time, and it can be a lot more work. Another similar coping mechanism would be an increased reliance on lip reading. Now, many of our patients will say that they're not able to lip read, but it's not necessarily a conscious skill. Our brain is going to take advantage of whatever information's at its disposal, and many of the different consonant sounds are shaped differently on our lips, especially if they're sounds that we produce with our lips or our tongue instead of our vocal cords. So many individuals develop a habit of relying on lip reading to separate different speech sounds without even realizing it. This can manifest in a number of different ways. You might find that individuals are having a hard time understanding speech when you're in another room, when you're in certain situations where they can't take advantage of lip reading, such as walking side by side or driving in a car, or even when somebody is wearing a mask. In a number of these situations, what's happening is the lack of those visual cues is causing them to rely on only the information that they're hearing acoustically, and there might not be enough information left over to separate between different sounds. An increased need to turn up the volume on something like the television is another clue that a hearing loss might be developing. Now, what's tricky about this is it might not be all the time. Some individuals will find that they're turning the volume up only in certain situations where they're not getting enough clarity. So they might be turning up the volume in certain scenes in order to hear those high-pitched sounds that are going to allow them to separate between different consonant sounds. However, in other scenes, when it's loud enough, it might be fine. This can cause individuals to blame the recording or the program, especially if they find that the difficulties are more pronounced in one program, such as a show that has accents or that has maybe more action scenes, as opposed to something like the news, which is going to have more visual clues to go on and less background noise to compete with. The same thing can be true for things like telephone calls. Individuals may find that they're relying on things like speakerphone so that they can take advantage of hearing with both ears as opposed to only one ear. These types of things can tip us off that individuals are using coping mechanisms to compensate for an underlying hearing loss. Having more difficulty hearing in noisy environments is another common one. People can compensate in these situations in a number of different ways. One way is that some individuals will try and take control of the conversation. If they're the one doing the talking, then they can't have any problems when they're listening. The other option is that some individuals will tend to withdraw. It might be easier for them to avoid the misstep of nodding when they maybe should have shaken their head in those kinds of embarrassing encounters by just withdrawing in the situation altogether. However, when they're removing themselves from the conversation, they're not able to participate and they may be at risk of social withdrawal. Hearing loss is associated with a number of negative outcomes, such as depression, anxiety, loss of intimacy, loss of social interactions in general. And because of these things, we believe that hearing loss is also linked with things like cognitive decline and dementia. For these reasons, social withdrawal is a major concern when people are having a hearing loss. The idea of our loved ones suffering from withdrawal is a serious one. Hearing loss has been associated with a number of negative outcomes, such as anger, anxiety, depression, lost intimacy, and social withdrawal. Social withdrawal has even been linked with cognitive decline and dementia, and so the risk of withdrawal is a serious one when we're considering our loved ones. So if we think we might be noticing some of these signs of hearing loss, naturally we want to step in and do something to help. But how can we do that effectively? One of the most important things is that we make sure that we position ourselves as an ally. The individual with the hearing loss might be already experiencing concerns, and they might also have some negative emotions associated with the idea of a hearing loss or the stigma associated with that. And so it's important that we're positioning ourselves in the right way. The first thing that we're able to do from here is find the right time and place to address the situation. It might be tempting to address the situation whenever it occurs, such as our loved one missing out on a detail in a conversation or asking for repetition again. However, when we respond in the moment, we're responding from our emotion as well. And that might not be the best time for us, and it might not be the best time for the individual to be the most receptive. It might be better for us to consider a different environment when there isn't an audience or there's less emotion involved. So when we find the right time and place to address the situation, we're also setting more importance on it, and there's less risk of emotions interfering with the conversation. To do so, we want to pick the right time and place to have the conversation. It might be tempting to address a hearing loss right in the moment when we notice our loved one maybe has made a mistake in conversation, or in the moment when they've asked us to repeat yet again. The problem with addressing it in the moment is that everybody's emotions are escalated. We're often coming from a place of frustration at having to deal with the same issues again and again, while the individual is also dealing with the negative emotions of the problem at hand. It might be better for us to wait for a different moment when there's less risk of embarrassment, there isn't an audience, and emotions aren't as high. When we do this and we find the right time and place, it's also setting a greater degree of importance on it, and there's less risk of it feeling like we're harping on the other individual. Keep in mind that we want to have our loved one's perspective in mind when we're addressing the hearing loss. It's very common for our loved ones to defend what's going on and find different ways to dismiss that the hearing loss isn't a real problem or that it might not even be there. This can be a source of frustration for both sides, but it's important to understand that this is their reality, and so their perspective has value. When an individual with a hearing loss says, I can hear fine as long as people don't mumble, this is their true reality. They're hearing the world as people mumbling in their world. And so this is real to them. We might know that there's other things at hand causing this, such as the hearing loss itself. But when we create a combative environment where we're arguing with them, again, everybody's having heightened emotions and people are more likely to get defensive and dig their heels in. So we want to consider that their reality is real to them and that's what they're experiencing. When we can consider that when we're having the conversation, they're more likely to be receptive, and we can take into account some of the other reasons that might be explaining what they're experiencing. For instance, when they're watching television and they're finding that certain programs aren't as clear as others, there's good reasons and explanations for that. And so understanding that what they're experiencing is real can go a long ways in having a receptive conversation about the topic. The next important topic to address with them is understanding the impact of the hearing loss. This goes beyond just the impact in the moment. For instance, missing the punchline to a joke, or finding that maybe the grandkids aren't calling as often because they know it's a challenge to speak over the phone. When we're considering the impact, we're not just considering the impact to the individual. Many individuals are willing to cope for themselves, and they can put up with it or deal with it and continue doing what they've already been doing for perhaps a very long time. We want to also help them understand that it's not just them that's being impacted by the hearing loss. A well-known professor in this field said that when one person in the family has a hearing loss, the whole family has a hearing problem. It's important for the individual to understand that when communication's breaking down, it's not just affecting them as an individual, but it's affecting everybody else that they're communicating with. And so when they can understand that the impact is also passing on to other members of the family, whether they're coping for them by taking phone calls so that they don't have to have a problem making an appointment, or by repeating the dialogue from a TV episode that they're watching, they can understand that that impact isn't just affecting them, but that's affecting others as well. Many individuals will be far more willing to accept change when they know that they're helping others as well as themselves. Finally, let them know that you're there for them. Accepting treatment for hearing loss or even having a hearing assessment done can be an intimidating process. Knowing that they have someone there to soundboard with, to go through the process, even just having a spare pair of ears in an appointment can go a long ways in making someone more comfortable. And we also know that people are far more likely to be successful when they have a good support network. You can be a very important part of someone else's success with hearing healthcare treatment.